Living conditions in an urban setting compared to rural areas vary significantly even with only a glance. That said, it becomes much more so as one would shift onto the topic of healthcare availability for people outside the city. Chintakula in 2020 notes how some major problems that have been identified by literature review in many rural areas are poverty, illiteracy, unemployment, homelessness, crime, social evils, lower living standards, lack of facilities, services, and health. With these problems being rampant in India such as they are similar to the Philippines, inequalities are bound to prevail. Thus, a myriad of concerns arises, one of these being healthcare inequalities within the community. Implications of poverty are well evident here as well. Not only do people living in rural areas have limited access to the best health supplies, but they also have difficulties in accessing the system itself. It is all the more so when one is unable to afford it due to living conditions, whereas it is the complete opposite for those outside rural areas. The study aims to push for the need for improvement of the healthcare system offered to rural areas where poverty is present to create balance in the community, thus eliminating the inequalities concerning healthcare in the Philippines. To be able to conduct the study, related texts, journals, and reports are to be reviewed and assessed to further support the credibility of the aim or goal of the study to be done. In a press release from the Senate of the Philippines in 2009, the availability of health professionals is lacking in the rural parts of the Philippines as most doctors reside in urban areas wherein the population is denser compared to rural locations. This does not only pose a problem for the suburban and rural areas of the Philippines, this also poses a potential threat to the health professionals from the sudden rise of cases, much like from the current pandemic, COVID-19. The lack of manpower will cause more problems when cases arises, as some may not be able to be given attention or given adequate medical equipment when only one professional is on the field. The study then tackled the main issues that cause this. It is as such so as to understand and put a stop to those that limit the overall development of people's conditions and the growth of their country. It was proven that difficult situations come with complications if such procedures, work ethics, and setting are uneven or unorganized if unprepared. It can give an effective result to how the workers can provide good health care to the citizens without hindrances if managed adequately.
The group shall showcase how poverty reflects on the availability of healthcare supplies and services in rural areas in response to its distance in between. Here, the realizations of having these medical facilities being unreachable to people who, more than ever, extensively need it in comparison to those who can afford the needed supplies as well as the time for transportation. The insurance of having a quick response to any emergency health cases is determined by the state of poverty of the families who may not be able to afford care. The following questions needed to be answered are as indicated. First, we have how do families living in rural areas obtain the necessary health service that they require? This simple question shall ask the people involved on how they obtain or manage to get the necessary health services they require in order to ease or alleviate their pain. Our second question would be how reasonable are the locations of medical facilities in respect to the distance from rural areas? This question shall take into consideration the opinions of the residents and the location or geography of the area to make the judgment if the locations of medical facilities are reasonable. On to our last question, it would be how does poverty play in determining the availability of medical supplies of health facilities? This question will also take into consideration the opinions and the abilities of the respondents involved, along with the reasonableness of the prices of healthcare services and products.
The paper shall follow the characteristics of qualitative research, wherein the use of phenomenological research shall be the specific format the paper will undergo, as it qualifies for its intended use, which indicates that selected individuals that are to be the main respondents have first-hand experience on the given problem or the event that is to be addressed in the paper. The group would prefer respondents within their scope or range through their judgment. Specifically speaking, purposive sampling produces logical reasoning through a group of people that have an initial purpose to the study. Multiple respondents shall be the scope size that must qualify the needed qualifications needed for the study. the experiences of families or those poor individuals who have an average to below average household income shall be the main theme of these respondents, especially those living at a distance from their respective health facilities. With the instrument, the paper will make use of the in-depth interviews to determine the needed data to be examined in the results of the study. In-depth interviews involve participants to be comfortable in what they can share information about, yet must answer the questions provided by the interviewer, such that it allows the respondents to reflect on their past experience more thoroughly, thus being comfortable to share the information for the advantage of the study. The interview questions will involve themes that portray the experiences of these respondents. In the limitations of the current world situation, the use of online video conferencing applications and softwares shall be used to interview the respondents. Face-to-face communication shall be enacted through this case where the consent of the interviewee is still needed, provided that they can also have the time for the interview.
As for the main purpose of the presentation, the main purpose of the study is to provide knowledge or information to those who may have the power to change a thing or two. The results shall provide a persuasive role to let them at least think about the families living in the rural provinces of the Philippines that are experiencing hardships such as the lack of availability in the healthcare facilities or products that may prove useful to them when accidents or emergencies do occur. This investment to stretch out the medical facilities will not only prove useful for the families but also to the country itself, which could have potential teenagers or children that can support the workforce of the Philippines when they become older to start working. As for the salient points of the study, the main points of observation in this study is the situation of the families living in the rural parts of the Philippines. Through the right order of events to be conducted, we shall be able to collect data in a more ethical way that does not leave a disadvantage to both parties, namely the researchers and the respondents. The opinions of the residents along with factual information about distance, technology, transportation, prices, and the like shall be the main basis of the researcher's judgment to the recommendation that would be given to let readers analyze or create their own judgment if such a study will convince them to take action.
The study will be able to spread awareness to regards to the current happenings and situations of families living conditions in rural areas that do not have easy access to medical attention and those who cannot afford to have so. Governing bodies can make amends to the system of transportation or upgrading the supplies of healthcare facilities for families to reach without much effort. It does not only showcase the percentage or overall summary of the family's condition, but also to preserve human lives, as these cannot be replaced that well, and further improve their way of living. Lastly, it provides an information source that such inequality in the community is present, most especially in these areas mentioned, as opposed to those not that affected by the lack of attention to these problems. Such limitations the group encountered was the criteria for the respondents due to its nature of being too general or a number of many characteristics are qualified for our study. The said nature of our research goes more in depth to the personal experience of each person that has undergone hardship for nourishment and health illnesses, be it physical or mental, due to the common reasons of poverty or the lack of supplies that one can support to the designated facility. By addressing this problem, the group had narrowed down the key priorities as well as the number of participants that are eligible to our research, such that it is in good convenience not only to the respondents involved but also for us, the group as well.
As to what the recommendations are to be said, To lower the potential death rate occurring in the said country, not only must they provide medical support to those who were born with unfair conditions in life, but they must also provide necessary emergency equipment for those who may encounter accidents. Not everyone is born with perfect conditions, and so in that sense, the country should at least spread out or widen the range of available healthcare or medical assistance to rural areas, such as people or families who live there may encounter dire implications or accidents. Thus, basic medical assistance is not enough to cure or alleviate the condition or pain the said person is having. This action is for the higher-ups to do, and the study shall become the basis of such actions that would serve useful to both parties. The presented arguments are why we want to accomplish this study. Using reasonable judgment along with factual evidence and statements will we achieve our goal in this paper. We appreciate you for your time and patience in listening. We do hope this has given you the proper knowledge and awareness regarding the situation of inequalities in our community.